Okay, let's unpack this. You know that moment when you're sitting in a waiting room, watching the clock, maybe feeling pretty rough, and you notice how things are flowing. Or sometimes how they really aren't.
Yeah, it's such a common healthcare experience, isn't it?
Totally. So today, we're diving deep into something we all face but maybe don't think about too much. Healthcare queue systems.
Yeah.
Like, what are they really, and why do they matter so much?
It's interesting, actually, this whole idea of waiting in line. It touches on some really crucial parts of healthcare. Things like fairness, efficiency, and even patient safety.
Right.
We've looked at insights from, well, some key players. Joint Commission International, they're global leaders in quality, and the National Accreditation Board for Hospitals here in India, NABH.
Okay.
Plus, expertise from Supremedic Consultancy, who help hospitals implement these best practices, info from HospiMatch, and a really relevant discussion from Supremedic's own Lifelines podcast. It all points to why respecting these cues is so important.
Absolutely. So our mission today isn't just about waiting room manners. It's really about understanding why respecting the queue, whether it's for an appointment, a test, whatever, why it has these surprisingly big impacts on fairness, efficiency, safety, basically a better experience for everyone.
Exactly. If you boil it down, these queue systems are fundamentally about managing, well, limited resources fairly.
Makes sense.
I mean, think about any hospital or clinic. You've got a certain number of doctors, nurses, rooms, equipment. You need a structured way to allocate all that.
So it brings order. And like you said, fairness. That Lifelines podcast mentioned something interesting. Like, yeah, triage handles the absolute emergencies, but everyone there has a medical need,
Precisely. Respecting the queue is kind of acknowledging that, trusting the system to handle everyone's needs properly. And, you might be surprised how chaotic it could be without these systems.
I can imagine.
Definitely. I mean, picture a clinic with no system. Everyone just pushing, demanding attention. Appointments, token numbers, even just taking a number. They're all tools to bring structure.
Right. Prevents chaos.
And crucially, they help staff maintain order and reduce the chance of mistakes. Errors happen when things get rushed and disorganized.
And that hits on patient safety, doesn't it? If doctors and nurses are constantly dealing with queue jumpers or feeling pressured, the risk of mistakes, diagnosis, treatment, it just goes up.
It really does. A calm, orderly system is just safer. For patients, for staff, everyone.
Okay, so that's the why, but what actually happens when people don't follow the system? What are the common ways this goes wrong?
Well, there are a few typical ways people disregard cues, and yeah, they all cause problems.
I bet one is trying to pull strings, right? Using connections, like, oh, I know Dr. Smith or something.
That's a big one. Trying to bypass the line through influence. And like that podcast pointed out, even if it seems small, it just fundamentally undermines fairness.
Yeah, because someone else may be sicker, but without those connections, gets pushed back.
Exactly. And it does something else, too. It can create this atmosphere of resentment in the waiting room. People see others getting special treatment, and trust just erodes. It really sours the whole experience.
I hadn't thought about that ripple effect on morale. What about pressuring the staff directly? Demanding to be seen now?
Yeah, that's another major challenge. Pressuring staff to skip protocols. The thing is, those protocols exist for good reasons, usually safety or fairness.
Right, they're not arbitrary rules.
Not at all. So when staff get pressured, it disrupts their workflow, puts them in a tough spot, and like we said, can lead to unfair delays for others or even potentially clinical errors. It just throws a wrench in the works.
It really does sound like a ripple effect. One person jumps the queue and suddenly everyone's wait time gets longer. Consultations might feel rushed.
Precisely. And that ties into just ignoring appointments or token systems, too. Showing up very late, or not having an appointment at all, but expecting immediate service, it derails the schedule for potentially dozens of other people who did follow the process.
Okay, so it's clear why respecting the system is important. But how do we navigate it effectively? Especially when we're maybe not feeling great or anxious. It's not about just sitting there silently, is it?
No, not at all. It's about understanding how to get the care you need while respecting the process. A really key thing, especially in emergencies, is trusting the triage system.
Explain that a bit more.
Well, the sources are clear. If your condition is genuinely urgent, serious chest pain, can't breathe, that kind of thing, you'll be seen quickly. Triage is designed for that. If you're waiting longer in the ER, it usually, though not always, means others are unfortunately in more critical need right then.
Okay, that's important to remember. Trust the triage. What about for less urgent stuff, like clinic visits?
Simple things make a huge difference. Plan ahead, book appointments if you can. Be on time for them. Maybe check the clinic's walk-in policy beforehand if you don't have an appointment. Just those basics help keep things running smoothly.
And how we communicate matters too, right? Especially if we're feeling anxious or in pain.
Absolutely. It's much more effective to calmly and clearly explain your symptoms, what you're feeling, rather than demanding to be seen immediately. Trusting the clinical staff's judgment allows them to assess things properly.
That podcast, Lifelines, also mentions something about leading by example.
Yes. In a crowded waiting room, if you're calm and respectful, it can actually influence others around you. It helps create a better atmosphere for everyone. It's a small thing, but it adds up.
Let's make this more concrete. Can you give some real-world examples?
Sure. Think about the emergency room again. Someone comes in clutching their chest. They're likely fast-tracked, right? Compared to someone with, say, mild fever who might wait longer. That's triage in action. It's necessary prioritization based on severity.
Not about who arrived first, necessarily.
Exactly. Then contrast that with an outpatient clinic. Picture someone demanding to see the doctor out of turn, disrupting a whole room of people with appointments. It causes delays, frustration.
Versus everyone just waiting their turn according to the schedule, which keeps things flowing.
Right. Or even think about large events like vaccination drives or health camps. Queue discipline there is essential for efficiency. If people start jumping the line, the whole thing just slows down for everybody.
Good point. And the sources had specific tips for family members too, didn't they?
They did. Things like, ideally, only having one attendant go into the consultation room to avoid crowding, not blocking walkways and waiting areas. Try not to raise your voice.
Simple courtesy, really.
It is. And maybe even helping explain the system gently to someone who seems confused or anxious. Also, avoiding things like trying to start unofficial separate lines or saving loads of seats. Just practical stuff that maintains order.
Okay, let's shift gears slightly. How do organizations like JCI and NABH fit into this, these big accreditation bodies?
Well, Joint Commission International, JCI, is huge. Globally, they've accredited over 1,000 programs in like 70-plus countries. And NABH is the key accreditation board here in India, part of the Quality Council of India.
So they're all about healthcare quality and safety. Where do queues come in?
Well, think about it. Managing patient flow efficiently, which definitely includes having and respecting queue systems, is a fundamental part of running a hospital well.
Ah, I see.
When patients move through the system smoothly and fairly, it creates a more organized, safer environment. And that's exactly what accreditation bodies like JCI and NABH are looking for and encouraging. It's a sign of a well-run facility.
So respecting the queue isn't just politeness, it's actually like a component of institutional quality.
Exactly. It's a building block. And the fact that consultancies like Suprematic help hospitals achieve accreditation tells you that good patient flow systems are considered best practice. Plus, multiple sources mention something else interesting.
What's that?
Patient satisfaction. Even if there's a wait, if patients feel the system is fair and organized, they tend to report higher satisfaction overall.
That makes sense. Predictability and fairness matter. Now, things are changing too with technology, right? It's not always just about taking a paper number anymore.
Oh, definitely. Technology is making a big difference. You see digital token systems now, with screens showing whose turn it is.
Yeah, those are handy.
And SMS alerts on your phone telling you when to come forward. Some places even have mobile apps where you can check approximate wait times remotely.
That's pretty useful. Anything else?
Some facilities are also setting up separate, clearly marked queues for, say, senior citizens or people with disabilities, which is, a thoughtful way to manage different needs.
So the advice there is, if these tools exist, use them.
Absolutely. Engage with the technology. It's part of respecting the system, and it can make your own wait feel more manageable. We're also seeing more virtual queues, checking in online, getting notifications. Still might involve some waiting, depending on demand, but it changes the dynamic.
Okay, so as we wrap this up, the big takeaway seems to be that respecting healthcare queues is, well, it's much bigger than just waiting patiently.
It really is. It connects directly to fairness, to efficiency, to safety, both for you and the staff, and ultimately, it helps create a healthcare experience that's just better, more positive for everyone involved.
So a final thought for you, our listeners. Think about how interconnected everything is in healthcare. Seemingly small things like respecting the queue, they ripple outwards. They contribute to the overall quality of care we all receive.
Yeah. Maybe next time you're in a clinic or hospital, just take a moment. Observe the system. Appreciate why it's there. It's all part of making sure everyone gets the care they need fairly and in good time.